Hello and welcome back to Patient Knowledge. I'm Dr. Kirmani and I'm back with another health video. In today's video, I will be giving you some information about an important health condition that affects the joints called gout. So let's get straight into it. In this video, I will be giving you an information about what's gout, what are the symptoms, who gets it, what brings it on, what are the risks and its treatment, and at the end of the video I will give you some rules of moderation. So stay till the end. Gout is quite common. About 4% of population suffers from this, or at least 8.3 million people have gout, which is quite significant and it has gone up in the last 20 years. So having a knowledge about this condition is going to be beneficial. Now what's gout? Gout is a type of arthritis that's caused by uric acid crystals which get caught in the spaces between the joints of the feet, the hands, and other large joints. The tissue around the joints become inflamed, and this inflammation triggers the sensitive nerve endings at the joint, causing extreme pain. Uric acid is a waste product from the body, especially from proteins called purines. It's passed out in the urine by the kidneys, which sometimes cannot cope with the load of the uric acid, and this causes a buildup in the body. Now let's look at some of the symptoms of gout. The main symptom is severe pain, usually in the hands or feet, especially at the base of the big toe. Sometimes gout can strike in other joints such as the elbow or the knee. The pain is usually severe and comes on without any warning. Often in the early hours of morning, you wake up with pain, and soon the joints become so tender that one cannot bear even the weight of the bedsheet. The inflamed skin over the joint is often red, shiny, and dry. The first attack usually involves only one joint and may last from a few hours to several days. Generally about 2 to 3 days, depending on how soon treatment is commenced. Sometimes there may only be one attack in a person's lifetime. Now who gets it? Almost any person can get gout because all human beings produce about as much uric acid as the kidneys can handle. However, it does appear to be hereditary and is far more common in men than women, especially between the ages of 30 and 60 years. It's one of the oldest disorders known to humans. Now, what brings on gout? Overindulgence in rich foods and alcohol can certainly bring on an acute attack in those who are prone to gout. It's associated with obesity and high blood pressure. Some drugs, particularly diuretics or the fluid tablets, injury, surgery, or starvation can bring on gout, but alcohol is the main factor. What are the risks? Gout is a curable disease, but if it's not treated, it can cause kidney disease, including kidney stones. Now, what's the treatment? During the acute attack, the earlier the attack is treated, the better is the outcome. You contact your doctor about the best treatment and the right painkillers. Aspirin is not the one recommended for the pain of gout. Bed rest is important. Some relief can be obtained by applying a hot compress or cold ice to the affected joint. Keep the weight of the bedclothes off the foot by placing a bed cradle or similar object under the bedclothes. Since gout may strike only once, no further treatment is needed apart from following the rules of moderation. If gout keeps returning, it will be necessary to go on to tablets that may have to be taken for a lifetime in order to prevent more acute attacks. Now, rules of moderation. These are do's and don'ts in gout. So let's look at the do's first. Restrict food high in purines. Reduce alcohol intake. Eat normal well balanced diet. Hydrate yourself as much as you can. Maintain a normal weight through diet and exercise. Wear comfortable shoes and get regular exercise. Well, here are some don'ts. Take your worries to the bed. Exercise too strenuously. Overexposure to cold. And don't drink excessive alcohol. Well, that's all for today. I hope this information regarding gout was useful in understanding everything about gout. If you wish to hear more of such information, support my channel by liking, sharing, and subscribing it. Thanks for listening. If you wish to hear something, leave it in the comment box below. Bye for now.